Good afternoon and welcome. I'm Neil Hawkins, president of the Herb Family Foundation. Today we are privileged to host and co-sponsor an incredibly important and very timely discussion about race as a determinant for public health. It really is a crisis for many reasons, but that will all be addressed by our speakers. In Detroit, we're seeing and experiencing this. The Herb Family Foundation has a mission to promote an environmentally healthy and culturally vibrant metropolitan Detroit and a flourishing Great Lakes ecosystem. Within that mission, we have a strategic focus on addressing two aspects of children's health in Detroit. First, lead exposures, and second, asthma due to air pollution. Detroit has troubling rates of disease in both these areas. We're very pleased to co-sponsor today's session with Wayne State University, the Wright Museum of African American History, and Detroit Public Television. I am especially thankful to Dean Michelle Williams of the Harvard University Chan School of Public Health for keynoting us today. Thank you so much, Dean Williams. Reminder, everyone is muted, so join the conversation and pose your questions via the chat feature. Also, please feel free to tweet to expand our discussion to our broader audience. Today's session will be also available later for replay. Let me turn this over to President Roy Wilson, the distinguished president of Wayne State University, who is himself a physician and medical expert. President Wilson?
Well, thank you very much, Neil. The COVID-19 pandemic has laid bare the inequities in public health that people of color face basically every day. Racism not only exacerbates public health crises, but it is itself a public health crisis. And certainly here in the state of Michigan, this is driven home quite poignantly by the statistics that Neil went over, but also just last week, the governor has declared racism as a public health crisis and has mandated that all state employees undergo implicit bias training, as well as a number of other recommendations that she's put forward. Disparities in healthcare and exposure to pollution and lead have also very much harmed health and prematurely ended lives in low-income communities of color. Wayne State is concerned about these types of issues, so we're very pleased to co-sponsor this important and very timely discussion. So we'll begin, first of all, with a presentation by Dr. Williams, as Neil mentioned, and I'll introduce her in a moment. But that will be followed by presentations from two Detroit organizations working in environmental health and justice issues. Dr. Williams has a very distinguished record. I won't have time to go over it in detail, but let me just say that she is an accomplished academician, researcher, and teacher. She's been associated with the T.H. Chan School of Public Health at Harvard for nearly 30 years. First as a student, then as a faculty member, later as chair of epidemiology, and now as the dean of the faculty. At this crucial moment for public health in the US and globally, she heads a school with an imperative to both serve and lead, working with colleagues around the globe to understand and solve major public health challenges. It's a real honor to have her. I'm pleased to present Dr. Michelle Williams.
Thank you. Thank you so much, President Wilson. It's an honor to be here with you today. And thanks to everyone here for your dedication to a healthier and more just and equal Detroit. Not everything that is faced can be changed, but nothing can be changed until it's faced. James Baldwin wrote those words in 1968. It is now 2020. And those few words still hold significant truths when it comes to racism. When it comes to racism, Black and brown people endure in this country every day. So in 2020, those few words are still significant for Black and Brown people in this country. We do not need to see another devastating video of George Floyd or another Black person being killed by a merciless police officer to understand that systemic racism has had its knee on the neck of the Black community since America began. And all of us, and I do mean all of us, have a responsibility to acknowledge and address this country's original sin of slavery, an institution embedded in racism. For generations, communities of color have faced vast disparities in education, in job opportunities, in income, in inherited family wealth, and in healthcare. Black communities have been legally, financially, and socially segregated out of neighborhoods with fresh air. They have been less likely to have housing security, access to quality schools, healthy foods, and green spaces. All of these factors have long harmed health, accelerated aging, and have prematurely ended lives. As you heard the president say, the COVID-19 crisis has laid bare these inequities. The crisis has held a mirror to this heartbreaking reality. Some have called this pandemic the great equalizer, as all of us in every corner of this country and the world remain at risk. It's important to recognize that the virus, although it might not discriminate, but our society certainly has. And as a result, people of color are bearing the brunt of this pandemic. We've seen that all too vividly in the Detroit area. As a city, Detroit accounts for almost a quarter of Michigan's coronavirus deaths, despite being home to less than 7% of the state's population. And most of those cases are clustered in the city's poor and overwhelmingly Black communities. Let me share two stories. The first is the story of Jason Hargrove. Jason, a Detroit bus driver, stands out in this narrative. He was just trying to do his job and support his family of 7, but the nature of his work put him in harm's way. He watched daily as countless of passengers boarded his bus, unmasked, some coughing without covering their mouths. Jason posted a video, and in this video, he pleaded for his neighbors to do their part to help him remain safe and to help him remain safely on the job. But it was too late. Just 11 days after posting that video, Jason died as a result of his viral infection. Then there's another story. This is the story of Keith Gambrel. Keith watched his father, Gary Fowler, beg for his life 3 times. 3 times. Keith took his dad to 3 different Detroit hospitals, and every time he was denied a simple COVID-19 test. Instead of medical treatment, Keith's dad was told, "You have bronchitis, you're fine, drink water." Mr. Gary Fowler died on April 7th without getting tested, even once, for COVID-19. These 2 stories are just 2 of hundreds, if not thousands, of similar stories. The reality is that people of color often receive inadequate care worse than their white counterparts would receive. That's true even when we control statistically for socioeconomic factors like income and education. For one thing, Black Americans are more likely to end up in lower quality hospitals. And just like Keith's dad, they are more likely to be dismissed, to be unheard, to be ignored, and to be sent home without adequate quality treatment. But what goes wrong in hospital settings is only a small part of the story. Black Americans also disproportionately suffer from underlying health conditions that make COVID-19 all the more dangerous and deadly. Black Americans have higher rates of heart disease, hypertension, and other chronic disorders. And being Black in America also means enduring psychological stressors linked to premature biological aging. All of these health issues conspire to make diseases like COVID-19 that much more severe. And nowhere is that fact more evident than in Detroit. In Detroit, where rates of diabetes outpace the rest of the state, where more than half of residents are at high risk for high blood pressure, and where the life expectancy is up to a decade shorter than in white suburbs just a short drive away. Imagine life expectancy just a decade shorter. And the only difference here is the 10-minute short drive to the suburbs. In America, being Black is a risk factor, but not because of biology, but rather because of the disparities in the drivers, those social and historical determinants of health that undergird all too common statistics that I just shared. And all of these disparities, we must recognize, begins early in life. For example, across the city, some 2,400 children suffer from asthma. That's 2,400 kids who are struggling to breathe, who are kept up at night, wheezing and coughing. These kids are concentrated in low-income, predominantly Black neighborhoods with higher rates of industrial pollution. This spring, at the Harvard T.H. School of Public Health, our faculty looked at COVID-19 data in counties with high pollution levels. The kind of pollution that comes from car fuel combustion, from refineries, and power plants that populate so many enclaves in Detroit. And what they found in this research was that such pollution had significant impacts on the rate of coronavirus hospitalization and deaths. For example, they observed that a person who has lived for decades in a county with high level of fine particulate air pollution is 8% more likely to die of COVID-19 than someone who lives in an area with just 1 unit less of such pollution. In the historic North End district, about 1 in 10 people contracted the virus at the height of the pandemic. But just a 10-minute drive away in the affluent, predominantly white Corkstown, the rate was half of that. Here's the fact. The fact is, no matter where you live in the US, your experience with COVID-19 has a great deal to do with who you are. And that reflects the systemic inequality that have plagued our country and left communities of color behind since long before this pandemic began. All of this that we are experiencing in this COVID pandemic must serve as a wake-up call. We must demand radical, large-scale investment in public health, at the level of municipal, state, and national levels that include policy interventions. Policy interventions ranging from affordable housing and paid leave to environmental justice and access to universal quality healthcare. We cannot let this moment fade without making the changes that will need to affect our lives, our children's lives, and our grandchildren's lives for the better. As Isabel Wilkerson said in her recent interview with Don Lemon on his new podcast called Silence is Not an Option, Isabel says that we should practice what she calls radical empathy. We need to put into the work, our educating ourselves and our intentional listening to others with an open heart to understand the experiences of others and to reaffirm our humanity. Every person in Detroit and every city across the US must face this reckoning, and it's only then will we be able to make sustaining, enduring change. I want to thank you all for allowing me this opportunity to speak with you this afternoon, and I'm very much looking forward to the conversation that ensues. Thank you greatly.
Well, thank you very much, Dean Williams. I think we have time for a couple of questions. I don't see any in the comments. Let me just see. I don't. What percentage of children in the city did the 2,400 children suffering from asthma represent? I'm not sure you would know that. That's specific to Detroit.
Yeah.
But let me ask you a question, and while I'm looking for any other questions that might pop up. I mentioned to you that the governor here in Michigan has declared the racism as a public health crisis. And one of the tangible steps she's taking, besides putting a task force of Black leaders together to advise her, is to mandate implicit bias training for all state employees. What other actions do you think this task force should be recommending to the state to mitigate the effect of racism as a public health crisis?
Thank you, President Wilson, for that question. I think as one of the member schools of the Association for Schools and Programs in Public Health, we recently had our retreat. And there I had the privilege to share with fellow deans across the country a conversation about what steps we need to take. I will tell you that the training and our understanding of the roots of bias is going to be important. But in addition to training, and maybe even upstream from training, there is a need for an education, for really reconnecting to the history of our country, to understanding that our institution, and this country in particular, is founded on structural racist policies and practices that bring forward, the health conditions that we find Black and Brown communities facing. So I think it has to start with a real reckoning, a real confronting, understanding the history and how racist policies and practices embedded in this country's, all of its institutions, bring about the health inequalities that we see. I think the other key issue here, and Byron Stevenson is someone who inspires this owning the truth, this reckoning with our history before we can actually start to build reconciliation. And so I want to underscore the importance of really the reckoning, the understanding of the history. The other thing I would say is every single one of us play a role in addressing the structural racism that exists. If we're in the academic space, for example, and we see that there are behaviors that are not conducive to inclusiveness, excellence, and belonging, every single one of us should use our voice to call that out and to move about making changes to the environment that is more inclusive and belonging. In the healthcare space, I think we really have to re-examine where healthcare dollars are distributed. Our public and social safety nets often underserve communities of color. And so we're going to need people to take elected office, to take roles in civil leadership, and to bring forward a diverse workforce that addresses and serves communities of color.
Thank you. We've got a slew of questions now, so let me see if I can get one of these. Detroit is facing a serious undercount in the census, which could have terrible impacts on federal funds to support public health. Is this getting enough attention nationally, the undercounting of people of color in this census?
I think that's a really important question. And I think Detroit, along with many other communities across the country, I think the latest estimate is we are likely to have something on the order of upwards of 60 million, if not more, undercounting across this country. That's going to be devastating for everyone. It has to get more attention. The problem that we all face is that we have a news cycle that is saturated with the concerns of the pandemic and the concerns of the current political campaign. But I would say that we really do need to shine a much brighter light on the fact that we have an administration that wants to shorten the time period for completing this census at a time when the pandemic itself has made it challenging for census takers to do their work in the field. We shouldn't be thinking about shortening it. We should be thinking about ensuring the health and safety of the census takers and helping them overcome the physical barriers that they're facing as they're trying to undertake the census during a time of pandemic. We need our journalists, we need the media, and we need the voting public to use their voice to promote a better vigilance in completing the census.
Well, thank you very much, Dean Williams, again, for your presentation as well as answering these questions. It was a real honor to have you. We'll move on now to Neil Hawkins, who's going to introduce the panelists. Thank you.
Thank you.
Thank you very much for that excellent discussion. Dean Williams will be coming back towards the end of the session. Our first discussant is Jamesa Johnson. She's a lawyer. She is a policy analyst at the Michigan Environmental Justice Coalition and Citizens Clean Air Council. She focuses on exposure to air pollution in Detroit and public health impacts. So can you tell us what's happening in this area and who's responding and what's going on, Jamesa?
Yeah, thank you to the Herb Family Foundation and to Wayne State and, of course, the Charles H. Wright Museum of African American History for having me. And a special thank you to Dean Williams for that insightful analysis she's provided us on today. It actually reminds me that a few weeks ago, I was actually asked to do an exercise where I explain the environmental justice work I do to my ancestors from 100 years ago. And I found that it wasn't all that difficult to explain because Black people are still living in the areas with the poorest air quality and the closest proximity to industry, to wastewater treatment facilities and landfills, and are still fighting to be treated equally by the law. All of which are things that I and many others in EJ communities are working every single day to build equitable policy around today. And so I think that the fact that issues from 100 years ago are not all that different is evidence really that Black people and other people who have and are discriminated against on the basis of race have been living in a public health crisis for generations. And we recognize that. And so to put it simply, racism, environmental racism is an issue that impacts not just one or two generations, but as Dean Williams mentioned, is a multi-generational issue in its reach, and its impact is still being seen today. Today, we understand that Black, Indigenous, and people of color are dealing with multivariant vulnerability. So here we have research done by Community Action to promote healthy environment. And they've presented us a heat map of the Tri-County Detroit area showing environmental exposure and health risks, as well as point sources of air. And so if we were able to overlay these maps, we would see very clearly that there is an intersection in where environmental exposure is and where the point sources are. While these maps of the Detroit area, we can go to the next slide. While these maps of the Detroit area are clearly, multivariant vulnerabilities, it's not just a Detroit-only issue. If we go to the next map, we'll see that this study actually comes from a study done by U of M School of Environment and Sustainability in partnership with my organization, Michigan Environmental Justice Coalition, and it identifies environmental justice hotspots across the state, dealing with all of those variants that I spoke about earlier. And according to the US EPA, Black Americans are exposed to 1.5 times more particulate matter emissions than any other population. And we know that particulate matter emissions really matter when we think about how they've impacted the comorbidities of COVID-19. Right. So the reality of populations dealing with the high environmental exposure and its correlation with race, I would argue, is one that gives us a blueprint of how to deal with our current climate crisis, our current public health crisis in a way that's not blind to the inequities of today. I think COVID is an important indicator of how we will, as a community and as a society, be able to respond to any climate disruption that might come up, because it really is climate disruption. I think that COVID has also taught us that the health implications of environmental racism are not just seen in long-term illnesses, right? We think a lot about environmental injustice and cancer, right? We know a lot about Cancer Alley and a lot of these things, but also lead poisoning, thinking about those things, asthma. But really, it shows us that people who are living in vulnerable communities are experiencing the effects in real time every single day. And what we've noticed as environmental justice advocates is that the work that we do today really does matter to people tomorrow as well as 10 years from now. So thank you.
Okay, we will next go to Lyke Thompson. Dr. Thompson is director of the Center for Urban Studies at Wayne State University, and he's going to address today lead in Detroit. So the metal lead and what's happening to whom and who's responding. After his remarks, we'll take questions of Jamesa and Lyke, so please go to the chat and put your questions in. Thank you. Lyke?
Good afternoon. Thank you, Jamesa, for an excellent presentation, and thank you all for inviting me today to talk about this important issue of race and lead poisoning in Detroit. And let's take a look first. Next slide. If you could go. The next slide, this one. This is a slide that simply shows us the distribution of the African American population in our Tri-County area by zip code, and the darker bluish purple colors are where African Americans are located. And as you can see, it's heavily, heavily concentrated in the city of Detroit, as high as 97% in one zip code. And that is an important fact because if we go to the next slide, African Americans in this metro area were segregated into the core. This was originally a product of de jure, that is legal activity, and de facto practices that led to the segregation. Now that is maintained by de facto real estate practices, it's maintained by history, and it's maintained by the overlying effects of income differences because some people can't afford to move to higher, more expensive suburbs. Lower income areas, those are the ones that are available to many poor families. And those folks tend to live in the core. Their concentration in the core means that African Americans tend to predominate in areas where lead poisoning occurs. The main cause of that in those older core areas is lead paint deterioration in the house. So let's look at the next map. The next map shows the same metropolitan tri-county area, and it shows down there in Detroit, you can see the high intensity red areas, and those are areas where lead poisoning of children is the most intense. Up to 17% of children in one zip code, which we'll talk about in a moment, get lead poisoned every year. This is an enormous number of children that get lead poisoned. Let's look at the next slide. These neighborhoods are the oldest neighborhoods in the city. These older housing units carry a heavy burden of lead, having accumulated many coats of paint from the 1920s through the 1960s. These older houses are deteriorating, and the lead paint in them peels off and poisons children. With few exceptions, the zip codes with higher numbers of children are those, higher numbers of children with elevated blood lead levels also have high percentages of African Americans. And there's a total of 1,200 children with EBLs, elevated blood lead levels, in Detroit. Now let's dive in and take a little bit closer look in the next map. This is just going to show Detroit. And in Detroit, we're going to look at, you can see that it's the areas of lead poisoning are in the core areas of the city with certain exceptions. And we're going to look at two zip codes, 48214 and 48206. Let's look at the next slide, and that will give us some idea about this. Let's start with the east side, 48214 on the east side, 82.48% African American, and 14.29% of tested children had an elevated blood lead level. When we went door to door interviewing over 900 residents in this zip code and used lead swabs in those houses, we found that 63.9% of those homes were positive for lead in the home. That's really serious. Well, now let's go to the east side, just over into the beyond the core area. 48206 on the west side, 88.99, nearly 89% African American. 17.97% of tested children had an EBLL, and I believe that's the highest in the state. And when we went door to door and interviewed parents of children and pregnant mothers, and we used lead swabs in their homes, we found that 82.6% of those homes were positive for lead in the home. That gives you an idea of how much these kids and parents are at risk for lead poisoning. Next slide. So, historic segregation plus lower income leads to high numbers of African American children in older neighborhoods. Those older neighborhoods contain huge levels of lead to poison children. High percentages of African American children have high EBLs as a result. And so what is done? Well, far too little is being done to stop it. And that's a whole nother conversation, which I hope to have. Thank you.
Okay. If we could also get Jamesa back. Hey, Jamesa, thank you for coming back. We have a couple of questions. I'll first go to Jamesa. Someone is curious about the impact of big pivots in environmental regulations, enforcement, etc., under current administration. Have there been increases in toxic emissions that could account for some of the air pollution effects?
Yeah. So, and the quickest and best answer to that question is that we don't know yet, right? Some of the pivots that EPA has enacted during the height of the coronavirus crisis is that we've seen less reporting. We've seen a wiggle room for monitoring from facilities on nitrous oxide and sulfur dioxide, which are known to be impacting to human health. And so what we don't know is how this is actually impacting people on the ground as of yet, because that reporting didn't happen because of some of those EPA rollbacks. So the gaps in the law may have actually exacerbated some of the issues that our communities are already dealing with, the impact of that standing and current pollution that they've been actually experiencing.
What are some of the major particulate sources that you're working on? What is of most concern to you and your organization from a particulate point of view?
Yeah, so I mean, we've been looking at and working on permits that involve steel mills, that involve oil refineries, that involve some of coal refineries, some of the dirtiest of resources that we actually have used and use still today. And so we're realizing that this is just not sustainable for our future, and it's actually not going to allow us to move towards the EPA's goal that they enacted actually in 2020, their action agenda to deepen environmental justice practice within their own programs and to lessen the impact on overburdened communities.
Okay, I'm going to switch over to Lyke. I'll combine two questions that have come in. One, can you touch upon the effects of elevated blood lead levels in kids? What does that actually mean in terms of, real health impact? And second, what can be done to lower lead levels in these older homes? Is it fixable? Why isn't it being fixed, et cetera? So kind of two large questions, but good ones.
Well, the first one is direct and clear from medical evidence. It's very clear that for every degree or microgram per deciliter of blood that a child is poisoned, it decreases their cognitive abilities. And with that, it decreases their ability to attend to things and focus. It undermines their language, their capacity to speak. And it also undermines their ability to avoid interactions with like the police, things like that, because they're very, very reactive. So all together, you put all the effects together and you calculate it. The Ecology Center over in Ann Arbor did a very careful analysis of Michigan kids just a few years ago, and the average cost per kid of lead poisoning, not for the kids that are severely lead poisoned, but for all the lead poisoned kids, is about $40,000 through their lifetime in lost wages, in cost to special education, in all sorts of ways. So it's a very substantial and ongoing impact. It's not removable. Once you're lead poisoned, substantially, you're lead poisoned. So moving on to, well, what can we do about these houses? What there really is one major way that you can intervene with houses, and that is that you can do what is called abatement. And abatement in Detroit, because we got a lot of these big old houses, can range anywhere from 20,000 to 40,000 per house or more. And so there's even with federal dollars, which is the principal source of the money, we only get a few hundred houses done a year, but there's 1,200 new kids that are lead poisoned every year. There's secondly a lead ordinance in the city of Detroit that has city inspectors going to the houses that are rental houses and requiring the landlords to do abatement. So that would be a multiplier on abatement if it were working. Both of these programs are substantially shut down by COVID right now. And so, and both were already way short of the goal, but now they're basically inoperable. So we need to figure out other ways of working with this. We have proposed on occasion relocating kids to houses that have already been made lead safe. That needs to get some more purchases and all policy alternative, but it's a really, really tough issue and it's very expensive. So it needs a lot more work and a lot more attention. Did I answer your question, sir?
Yeah, I think it helps. There was an additional question that really came in, I would say, for both of you, and and this wasn't posed with judgment, but it was a question across all. How can you take this academic knowledge, what someone is characterizing as academic knowledge, be it air pollution, be it lead, be it in the broader public health areas covered earlier, and actually get them implemented in these neighborhoods in a place like Detroit? How do you take the knowledge and make it happen locally?
Jamesa, go ahead.
Yeah, sure. So I think that there's work that's already being done. There's our own like community education program. There's multiple community education programs on clean air. I know that we have our own Clean Air Council that's open to anyone who's interested in learning more about air quality issues in their community and how to actually deal with them. I know that University of Michigan Dearborn also has a Clean Air Council program as well. I think that there's also been work that's been happening for upwards of 20 years, really in the city around air quality and pollution and how it's been impacting disproportionately Black folks, brown folks, non-English speaking folks. And so the real changes, and I believe there's also some questions around like, what do we actually do about this and who would be the targets? It's thinking about our government and how we are valuing human life and human health, right? And so that is done a lot through our regulatory system and how we are actually regulating the pollutants that are coming into our communities and where we are actually placing these facilities in proximity to communities of color. So in a state of perfect social and environmental equity, no one community would have to bear the brunt of environmental toxins. Instead, we would be investing in the reduction of pollution in our air, in our water, and in our soils.
So from the lead poisoning vantage point, the ordinance the city uses to enforce against rental landlords was a product of the advocacy of a series of advocates around the city that have been working on this issue for 2 decades. And and then the improvement of that under the Duggins administration was also a part and parcel of that advocacy. We're advocating that they restart the program right now. In addition to that, we're working this moment with a series of parents of children with elevated blood lead levels to train them and facilitate them in taking advocacy stances with their legislators, with their council members, with all sorts of people that to get them more knowledgeable and activated, I think, on this issue. And then there are both city and state level groups that are trying to impact the legislature and move issues forward on this. All kinds of legislation that needs to be pushed that hasn't been pushed because of the power of landlords in the Michigan State Legislature.
Okay, I'm going to go to one final question, and then we'll give Lyke and Jamesa a minute to respond overall, closing comments. Then Dean Williams will come back. But what one thing, you've got hundreds and hundreds of people listening to this right now, watching it. What would you want people watching this right now to do when they turn off their broadcast?
I'm quite clear. I think the thing that we could do right now that would make the most difference is to write an email to Duggan and say he needs to restart the inspection program to assure that children are living in lead-free environments in rental housing. That enforcement has been stopped. We need to restart it. He needs to figure out how to deploy his people using PPE, and that can be done. That's completely feasible. So that's the one thing I would say for immediate action.
Okay. Jamesa?
Yeah, I would say that it's going to take all of us to reach out to our elected officials at the state level, at the local level, as well as at the federal level, and say that we want to see cumulative impact assessments, just like the one that I presented today, implemented at the state level, and let that be our guiding light for how we are actually distributing resources, how we're deciding in regulatory regimes, what kinds of mitigation we can actually do, and for future reference for how we deal with the impending and ongoing climate crisis that we're living in, how we're actually distributing resources to those communities that are most vulnerable and most heavily impacted by air quality issues, by lead issues, by water access, energy access. All of these things need to be looked at from a lens of equity and understanding some of our current and past mistakes.
All right, so we're into summary. Thank you. We're into summary. So Lyke and Jamesa, you each get 1 minute to react to the whole broadcast, and then Dean Williams will have 3-4 minutes to give her summary thoughts. And after that, Neil Barclay will come and close. And I believe we have a poem about this challenge we're facing at the very end. So, Lyke, you're first.
Well, I think we have to think of these environmental challenges as above and inside and even below our homes and surfaces in Detroit. Think of it this way. Above, we have all this pollution that's coming into the environment because policymakers in Lansing have felt, or the EPA have felt, that they can allow poison to be distributed into Detroit. That's bad. We need to fight it. Number two, in our houses, there's lead. This lead needs to be taken care of. It's not going to go away. It's an element. It won't disappear. If you don't abate it, it's there. We need to take direct action to get our governmental entities to do something about it, and we know what to do. It's not like we don't know what to do. We know exactly what to do. And then below, something that people don't even know very much about, in the Dados layer, in the soil layer below your house, increasingly we're coming to understand that there are pollutants traveling through that and then coming up through basements. And we're finding, we had preliminary evidence in other work at Wayne State that shows that pregnant women and their fetuses are affected by that. So this whole set of environmental issues is hugely important to how we make Detroit and southeastern Michigan a successful place. That would be my say. Thank you.
Yeah, I would say that, there's a long history of correlation between environmental harms and low income, people of color, indigenous communities. And while we've heard a lot about studies and data and numbers to support that data, it's important to our future that we value the voices, the stories, the lived experiences of people who are actually experiencing these disparities every single day that much more, right? This is because it's through listening to the real subject matter experts, the people who live in these communities on the front lines, that we can actually build solutions to these problems that are the most impactful. And I think that it's possible for us to do that in a way that lends itself to equity, lends itself to a better future, and to one that we're more prepared for, and that everyone can actually survive as well. Thank you.
That was an incredible set of presentations, and I feel so honored to be a part of this conversation. Let me just make a few observations. One, we heard from Jamesa a brilliant exposition on environmental justice. And from Dr. Lyke Thompson, we heard and understood the high prevalence of elevated blood lead levels in children in 2020 in the United States, in Detroit. What strikes me from this whole package of conversation this afternoon is just how multidisciplinary this conversation has been, and just how impactful it is for us to understand that when we talk about environmental justice and we talk about air pollution, we talk about blood lead levels, and we talk about COVID, we are talking about health consequences that impact now, here and now, but also across generations. What we've heard are essentially how social, historical, political, and environmental factors impact a woman's health, her newborn's health, children's health, their cognitive ability, cognitive capacity to develop normally, to acquire educational inputs that would allow them to be competitive in a job market, to live a full life and participate in the full economy of our country. And all of these are factors that precede their birth because of the place where they are born and the place where they live could be contaminated by lead. Or a young child with asthma having asthma exacerbated because of the environment around them. Public health is a very important and complex discipline that is evidence-based and science-based and requires the input of the basic sciences, the political sciences, the environmental scientists, and the quantitative sciences, so that we can observe, we can learn, and we can do things to prevent disease and promote health. The question about, how do we move this beyond an academic argument and into something that actually improves population health? I thought the question was really well answered by both Lyke and Jamesa. And I would add that for us to really close the gap between the knowledge we have and the things we still have left to do, we have to think hard and work harder at working across disciplines. We have to have government engagement. We have to have philanthropic engagement. We have to have individual citizens engaged. We also have to have industry engaged, because all of us reap the benefits from a healthier, more just society when we invest in promoting wellness, preventing disease at every level. One last thing I will say is that the overall overarching topic of this conversation is racism as a public health problem. We have to reconcile the fact that health is a human right, that health is a function of where we live, where we work, where we learn, where we play. And if we are really going to build a just and healthy society going forward, we have to reckon with the fact that up to now, access to all of the drivers of good health and wellness have not been evenly distributed across all of our communities. And so we have to work towards equality, we have to work collaboratively, and we have to hold our elected officials accountable to making sure that the funds and the data are well managed in ways to prioritize the actions that we need to take. It's a privilege to be a part of this conversation. I thank you.
The mission of the Charles H. Wright Museum of African American History is to deepen the understanding and appreciation of African American history and culture as we celebrate the profound impact of people of African descent on all aspects of American life. We are pleased to have been able to co-sponsor this event with the Herb Foundation and Wayne State University, which builds on the series we produced with Detroit Public Television on COVID-19 and environmental racism. We invite you to visit the Wright soon, participate in the census, and vote in November. To close out this program, we have a poem from Simone Jones of Detroit's Inside Out performance troupe. Thank you for joining us today. Here's some.
The water. Since October 2019, I've been afraid to drink from my tap because at least 13% of Inkster is infected with lead. The city passes out complimentary water filters like face masks in a pandemic to account for the lack of tests. They know the filters are ineffective when used too often. Nothing ever really stays clean without the upkeep. The upkeep is just as expensive as the things we already can't have. Officials say, take them just in case you need them, though they never actually get around to checking the quality of everyone else's water. We go broke buying bottles of water. We break like cactuses, wondering how long we'll be pricked with worry about a necessity. I can't even begin to imagine how Flint feels. Clean water was never a problem when I lived in the rich white suburbs. We never worried about drinking water the color of our skin. It's August 2020. Flint has been afraid to drink from their taps since April 2014. There are Flints all over this country. Inequity loves the hood. This can't be a coincidence. I get it, I guess. Why remove the poison when you could just pump it into Black bodies? Kill two birds with one stone. Get us out of your neighborhoods, out of your minds, out of the world. We know y'all don't care. Racism is only now being declared a public health crisis in Michigan. Our voices have been drowned out for decades. It's a good thing we're resilient. We know the power of filtering out madness, of purifying ourselves, like water. Thank you.